Hi there, welcome along to this live stream discussion from Methodist Central Hall, Westminster. My name is Dan Forshaw. I'm the Communications and Digital Outreach Coordinator at the church, and I'm delighted to be hosting this discussion online for you this afternoon. We're on Facebook Live via our Facebook page. We're on Twitter for the very first time, broadcasting live on Twitter, and of course on our YouTube channel as well, where you'll be able to watch our usual Sunday morning services. I'm delighted that we've got a panel here today that I'm going to introduce you to shortly. But what we want to happen with this discussion is for you to post your questions and comments on your particular social network. So if you're on YouTube, you'll find it, I think, to my, let me see if I can get this right, the right way around. It's either to one side of me anyway. Please don't forget, if you're on YouTube, to hit a like. That means that the broadcast will be sent to more people. Make sure you are subscribing to the church's YouTube channel as well. You can, of course, like and comment on Facebook, and Twitter will also do it as well, so I am told. So I hope it all comes through. But we are discussing today about the COVID-19 vaccine. There has been a lot of reports, even in the press this morning, about how minority communities are 4 times more likely to contract the COVID-19 vaccine and die from it, and yet they are only taking up half the allocated COVID vaccine spots. So we're going to try and talk about that today. It's not a closed discussion, but I do have to insist that all the comments that are posted do fall in line with our social media comment guidelines. So please refrain from anything that may fall foul of that. Otherwise, you may have to leave the discussion. If you want to know more about our social media comment policy, you can go to mchw.live, head to the bottom, and the comment policy is there. So it's great. And I'm really, really pleased that my colleague on the staff team, Revd Lansford Penn-Timity, who is our Deputy Superintendent, is joining us as well in the discussion. Lansford, welcome. Can you tell us a little bit about what you're wanting to bring and what you hope people will be able to understand at the end of today's discussion?
What I'm hoping to bring, as you've just mentioned here, is people from the BAME communities from which I belong to, as well is the fact that we're really scared for so many reasons and so many factors attached to this, why the uptake is very low from us. And what I want to bring today is the fact that our contribution will help the United Kingdom, Great Britain, to deal with this and to end the lockdown and to resume life as soon as possible if we're able to take up this vaccine and help the country to get back to that place of safety. That's what I'm hoping to bring, to help the UK to become safe again by encouraging people in the BAME community to rise up to take up the vaccine.
Thanks, Lansford. And I'm really pleased that Grace, your lovely wife, is joining us as well. Grace, you're a nurse in the National Health Service in accident and emergency. We're really grateful for you to give us our time. You're also part of the, I've just realized I'm not on screen there. You were also part of the Methodist Church's podcast this week as well. I just wondered if you could share with us, Grace, your experience of COVID in the NHS in the last 12 months and what a difference that has made to our healthcare system.
Thank you very much, Dan. I want to share this afternoon that COVID-19 is real out there. I know there are a lot of people who are thinking, oh, this is just a myth, this is not real, this is just another winter flu. But all I can say is that if you had to come to the hospital yourself and see exactly what is going on, you'll know that this COVID is real and it's scary out there. It's busy, it's emotionally and physically exhausting for the frontliners, and it's so sad for the patients and their families. So that's what I want to bring forward this afternoon.
Thank you very much, Grace. Thank you. And I'm also delighted that Dr. Charlotte Abson, who is a consultant oncologist, is joining us from Kent. Charlotte, tell us a little bit about what a vaccine actually does and kind of maybe what's in the vaccine.
Thank you. Yes. So the vaccine contains an inactivated part of the virus that can't replicate inside your body. So it can't cause you to get COVID. And it tricks your immune system into thinking that you have got COVID. So it produces antibodies to help fight the infection. And then when you're presented with the infection for real, those antibodies are at the ready to help you fight the infection. So that's the basis behind all of the COVID vaccines.
Thank you very much. Thank you. And we've got everybody in here now as we go along. So I wanted to start, Lansford, just going back to yourself. We've had a question coming in terms of from a ethical point of view as a minister, is it right to take a vaccine? You know, is it the right thing to do? You know, one of our church members has asked that question.
Well, what I would say is right and wrong is difficult to have a clear cut in terms of right and wrong. But what I know, vaccines, this is not a new thing. This is something that has been with us for a long time. This morning, those of you who listened to the service, Alison Bryan said this on our reflection this morning. I will quote it. It's that God brings healing through so many ways and means, through the gifts and skills of the medical profession, through the support of communities and kindness of families and friends, but also through prayer. So whether this is right or wrong, one thing we know, God brings healing through different means. And God is not against the scientists or against the professionals who are doing this. We all work together. So from that point of view, where this is a collective effort, where God can come to us in different ways and different means with healing, I think it's something for us to look into and to consider. Because even in the Bible, if I will quote what Jesus said in Matthew chapter 9, verse 12, he said, but when they heard of it, he said to them, those who are well have no need for the physician, but those who are sick, our world is sick right now. We need a physician. And if Jesus is pointing us to a physician, why not take the virus and follow their advice? That's what I would say.
To say, you mean take the vaccine?
Take the vaccine. Take the vaccine.
That's, Charlotte, I just one of the things that has often come up is kind of how has the particular vaccines that we have, the Pfizer vaccine, the AstraZeneca Oxford one, I think there's the Moderna one, and I think there's another one as well coming around. What sort of happens in medical circles in terms of getting those things approved? Is it just some civil servant sat in a room somewhere, or is there actual, you know, experts in the field who approve these things before they go into the rest of our arms?
So first of all, trials are done, clinical trials are done, and there have been well, tens of thousands of patients involved in the trials, and the early trials that have come through for the AstraZeneca and the Pfizer vaccines, they were what we call control. So half the people had the vaccine and half the people didn't, and then they've been followed up to see what's happened to them. So those studies are then published, and they're published in what we would call a peer-reviewed journal. So you can't just publish them in your local newspaper or on your home website. They have to be reviewed by other scientists. And then when that evidence is deemed strong enough in favour of a vaccine, that's then considered by the MHRA, which is the Medicines and Health Products Regulation Agency, which is a government agency. And they look at the evidence, they look at all the trials that have been done, and then they decide whether or not there's good enough evidence for the drug to receive a license in the UK. And so 3 vaccines have currently got a license in the UK, but only 2 of them are actually being distributed, the ones that we've already mentioned. The third is not yet ready in terms of its supply, but the evidence is strong enough for the 3 vaccines. And then there's after a drug or a vaccine is licensed in this country, there's what we call post-marketing surveillance. So that if, because any extremely rare side effect, so if the side effect is less common than, I don't know, 1 in 20,000, it may not be picked up by even those big studies that have been done. So anybody can report if they think they've had a side effect from the vaccine. They can report it themselves. It's called a yellow card system, and doctors can report as well. And there's also some anonymous reporting that gets done as well behind the scenes. So it should be very safe indeed.
Great. Grace, I just wondered, in terms of age profile of people you've seen coming into hospitals, is it mostly still elderly people contracting COVID, or are you seeing younger people coming in and you know, with quite desperate symptoms? I just wondered if you could talk about kind of how things have changed over the last year with the patients that you've seen coming in.
Thank you, Dan. The first wave of COVID, which was March, April, May last time, we saw more elderly people. But unfortunately, things have changed now. This time round, we're seeing younger and younger people. What I mean by younger people, talk about people under the age of 50. because you know, they're the ones who seem to be, you know, are coming a lot this time around. And I think it's because as well people, you know, the advice is when you've got symptoms, stay at home. And unfortunately, some other people that are staying at home until when they're very, very ill, that's when they're coming in hospital. By that time, things are more or less too late for them. But it's a wide range. But at the moment, we're seeing more younger people, even in their 20s, in their 30s, you know, coming through the doors with very, very serious illness, COVID related. So yeah, it's not just the elderly, it's the younger people as well.
Thank you, Grace. Thank you. We have a question from Rosalind. I'm just going to bring it up on screen. Rosalind asks, is it possible to ask about this vaccine and allergies to nut and sesame anaphylactic reaction? Charlotte, I wonder if you're happy to pick that up for us, please.
Yes, so anaphylactic reaction. So if you do have a very severe allergy or history of severe allergies, it's probably recommended that you don't have the vaccine. There isn't any nut containing, there's no nut products in the allergies nor seeds, but sometimes there's if you've got a sort of overstimulated immune system, that is something that we would have concerns about if you're known to have had an anaphylactic reaction to something, even though there isn't any nut or seed in the vaccine. Certainly for the Pfizer vaccine, you have to be observed for 15 minutes afterwards because there have been some allergic type reactions. There have been no deaths from anaphylaxis.
Great, thank you very much. Thank you. I've just got to figure out how I hide that. There we go. That's fine. It's my first time using this piece of streaming software. We're going live on something quite important.
You're doing great, Dan.
So, I mean, those of you who watch our services online will know that we have technicians on board and we have myself behind. It's literally me and a mouse for this one today. So hopefully everything's working okay. Don't forget, everyone, if you're watching on social media, we really do need you to give a like, whatever platform you're watching on. If you're on Twitter, if you can retweet, that would be absolutely fantastic. But most importantly, we would really like your questions to come in on the comment box. So please post your questions in whatever social media channel you are on, and we will do our best to address all the questions before 3:30 today. We have another one here. This is from Reverend Rowbottom. Why is the UK happy to vaccinate over 60s with AstraZeneca, whereas many European countries are saying there's not enough evidence to show it's both safe and effective for the elderly? Anybody want to take that one, Grace? Are you oh, Charlotte, I'll come to you, and then maybe Grace can follow on. Charlotte.
So I think that in those studies that I talked about, there were relatively few patients included over the age of 60 or 65. So I think there was only about 10% of patients in that age group. And so some countries have taken the view that therefore we don't know that it's safe to vaccinate that age group. There are trials coming through where more patients over the age of 60 have been included. And we know from our experience with the flu vaccine that there's no difference in terms of reaction or side effects or effectiveness, particularly if you're over 65 compared to under 65. So we don't expect there to be a worse outcome if you're older. And obviously each country has to make a decision for itself what they want to do. But certainly in the UK, we're happy to recommend the vaccine for over 60s. Indeed, there's some evidence, there's a lot of evidence that in terms of side effects, it's better tolerated in the older age group. So that's encouraging.
Great. Grace, if you
Yeah, I was just going to say what Charlotte said, really, to say that I think it's just because of lack of the participants of the people over the age of 60. So therefore, there a bit of uncertainty. Say, they didn't use a large number of the participants in the over 60s. But as Charlotte says, to be honest, it's been proven that the side effects that can happen to under 60s and over 60s is going to be more or less similar. So, and in UK, it's been proven to be safe enough to use the vaccine. And I think the other countries like France or Germany or Belgium, I think they want to do a bit more research into the over 60s. So, but as I say, each country is taking has got its own views on it. And but in the UK so far, everyone can have it.
Thanks, Grace. Lansford, I wonder if I could come to you and just ask, what are some of the historical events that have happened that are causing maybe hesitancy within the BME community about taking up this vaccine? And what have you come across? I know that you've had experience of people being in touch with you and asking your advice. I was wondering if you could maybe cite some examples that maybe people don't want to mention in the chat, but maybe you
well,
talk about.
Thank you very much for that. As I say, some of these things that NHS data recently flagged up, they're so true because of the conversation I've had with some people. And the hesitation mostly is coming from areas such as historical mistakes that have been made wherein Black people or ethnic minority people were used in clinical trials that went awfully wrong. And those things are out. And so because of that, people are a bit hesitant in terms of rushing to get the vaccine. And also ongoing equal treatment for BME. We've experienced this with the health services, both in America and here in other parts of the world. Talk about abuse, bullying, and throwing them into the firing line. Remember when this started, the BME community were, recorded the highest number of deaths in that time. So all that has got a little bit of suspicion, mistrust again in the messenger and the message that is out there, disinformation, the anti-vax people and all those things going out. Now, because of social media, we all have a broadcasting station in our hands, our phones. We tune it and we just broadcast news, and it's proving to be very difficult for people in this category to make up their mind because of all this information that is out there. Fear is another factor. Fear, they're afraid because every wise person will be afraid to put something into your body. And so fear is causing that. And all this we can overcome through education and all that is going on. The other one I'll mention is suspicion that somebody mentioned to me yesterday. Somebody said to me yesterday, how do you know that the vaccine they're putting in your arm is the same one that went into the Queen's arm? For us as BME people, is this something that is substandard that they're giving onto us? So all those myths are out there and misinformation, and it's causing a huge problem. And I think that's why people are hesitating to take it. But we can change this by education.
Thanks, Lansford. A question here from Maria. Might we have to have a yearly vaccine, or is it too soon to know? Charlotte.
So almost certainly we will have to have a yearly vaccine. And this morning on the news, they're talking about a booster perhaps even as soon as the autumn. But certainly for the flu vaccine, we have a new vaccine every year, and it's tweaked and honed to give us the best protection. And it seems very likely that this will be the same for the coronavirus vaccine as well.
Great, thank you. I'm just trying to look at those things. I guess, a lot of the questions that are coming in are ones we have already answered. Marion asked the question again, what's in the vaccine? I think, Marion, we discussed that. It's this, I'm trying to, Charlotte, tell me again. I'm trying to say there's two different types.
It's a particle.
The AstraZeneca vaccine is different from the Pfizer vaccine in terms of what the active parts are.
They are very slightly different, and as I say, I'm not going to be able to give you sort of chapter and verse. There are several different ways of making a vaccine, and they do use different ways, the AstraZeneca and the Pfizer, but they both essentially are tricking your immune system with a bit of inactivated virus to make antibodies to fight it, so that when you do meet the real virus, you're ready with those antibodies to fight it.
Great, thank you. Go there. Lovely. We're still waiting for some more questions. Please do keep them coming in. I've got a couple more questions that have come in via email. Let's have a little look at this one. Yeah, is it why are we having why is having a lockdown so important? Why is not being able to go to church, not being able, in terms of being able to meet together and sing? Why is singing? Grace, I was just going to come to you. Why is singing such a bad thing to do in the moment of this pandemic? What is it about singing that causes us these problems with the vaccine?
Oh dear, I love singing. I love singing. So yeah, it's like torture. If we can look back, I remember a few weeks ago when they lockdown, when we went back into lockdown, it did say places of worship can remain open, but obviously we cannot sing. It's because singing is more like you're when you're projecting a lot of bodily fluids. So as a result of that, it's easy to spread the virus. And although you can be in the at a distance, to be honest, some of the churches it's not possible to be physically 2 meters apart. So if you're singing and you're projecting that bodily fluid, you can easily spread the virus. And then you are in this confined space, with no much ventilations and things like that. So that's why that is the case. So I think, to be on safe side, that's why the churches are closed at the moment. But they say that all means of still worshiping, on Zoom, on Facebook, and things like that. So yeah, it's not easy, and we want to get back to church as soon as possible so we can sing. So I think that's why it's important that for this vaccine, to get on top of it and hopefully get as much immunity as possible, build up antibodies, and we can go back in the worship places and sing and enjoy and praise our God.
Thanks, Grace. We've we slightly covered it, but I want to come back to it. Rose has asked this question. If there's any delayed reaction, and there's also a few people talking about antidote and stuff for the vaccine. If there's an issue with the vaccine, I guess maybe it's because what do you do if you have a reaction? And Charlotte, I just wonder if you can come back to you in terms of, you were talking about this 15-minute observation period after the vaccine, and just to sort of highlight this, that doctors, you talked about the yellow card system. I just wonder if you just reiterate that sort of side of what the safeguards are with the vaccine.
So we know that side effects are common with the vaccine. So there's two different types of side effects you can get. You can get an immediate allergic reaction, and that's why you're vaccinated in a centre where there is the right equipment available. So you'd be given all the things that you would normally given for an anaphylactic reaction. Most reactions are not anaphylactic. They would respond to steroids, adrenaline, antihistamines, that sort of thing. But the more common side effects are a sore arm. I mean, I've been fortunate enough to have both doses of the vaccine as a frontline worker. So yeah, I had a sore arm for a few days, but I took some paracetamol and that was absolutely fine. I felt a bit achy and fluey for a couple of days, but really it was, these are not things that you would expect to be cause you any serious problem. I managed to go to work and do everything that I was normally able to do. I think that in terms of, there's no sort of antidote. There's treatment for an allergic reaction. There's no antidote to the vaccine. So yeah, I think that's all I can say, really.
Thanks, Charles. I'm just going to bring Grace in there. Go ahead, Grace. Can you hear us, Grace?
Yes, I can.
Okay, go ahead.
Can you hear? Yeah, just like Shout say, I think the most common side effects or reaction is just sore arm or maybe a bit of headache, and some other people that are even saying about having a raised temperature. But there have been some issues. I'm not trying to scare anyone here, but there has been some people presenting in A&E with just a little bit more severe delayed reactions to the vaccine. And the people end up being in hospital for a little bit. But I think what is going out there, because it's a new territory, I think some of it is psychological. People are scared. They've had this, and all of a sudden they've got a temperature. They think, have I got the COVID-19 now? Why? So people are scared. Say, oh, what is happening now? But in very rare cases that I've come across in any, will have people that they've presented with, mild stroke-like symptoms, which, so, but at the end of the day, you cannot say whether that is because of the vaccine or not, because there isn't much evidence out there. But as you say, there's no antidote. Like anything else, you can have a reaction to anything else. You can have paracetamol and have reaction to that. So this vaccine is to protect all of us, to get us going, to get us back to the normal as soon as possible. So, if we can trust a packet of paracetamol from over the counter, we don't even read the instructions. We just buy over the counter and trust that it's going to take off the headache. I think we should go in faith and just trust in God that everything will be all right.
Great. Thank you very much, Grace. Lansford, I'd like to come to you, and I'm going to pose this great question from Naomi, but I'll just put it into context for what I'd like on the answer. Do you think the whole population will be vaccinated by December 2021? In Italy, we are getting less stock of the vaccine, which means less people who can get it. And Lansford, I wondered, because there's other news reports that have come in about how effectively until the whole world has had a vaccine, it's still going to be around and it's still going to be a problem. And I just wondered, from a minister's point of view, from someone who grew up in Africa, kind of what you think, governments really should be doing in terms of getting these vaccines out to other countries that maybe, we've seen, even just within Naomi's question there, how the EU and the UK, there was tension last week, 10 days ago, about supply and how they were playing political games with it. And I guess my question would be, how would you think it needs to be done without playing political games?
Well, I think there's a very powerful quote out there. I'm not quite sure where it came from. It said, "No one is safe until everyone is safe." And that is so true in terms of COVID-19, because we don't quite know yet, as the expert Grace and Charlotte have said a bit about, this initial stage of what's going on. But government and authorities and powers, we all have to ensure that this particular quote be our watchword, that no one is safe until everyone is safe. These strategies that we are seeing as initial stage, there might be logistical problem or nationalist problem, but we have to think wider. The Bible says God so loved the world, he gave the Son for everyone. And so this one, when we are looking at it, I think we have to look at it from a global perspective, global point of view. Those poor countries, those countries who cannot afford to get into the market and have this rush to get the vaccine to their people, we have to have them in mind. We have to have them in focus. They must be on the to-do list to see how we facilitate for this vaccine to roll out to them. Again, the suspicion is there because they don't have money. I grew up in Africa. There are lots of things in Africa with the polio vaccine and some other vaccines there. People are saying we might get a substandard vaccine coming down to us in Africa. All those things are going on there now. We have to ensure those people and reassure those people that there is nothing like that, and we have them in mind, and they're part of the conversation, part of this initial plan, because what we are seeing, the rush that is going on in wealthier countries, Europe, America, the UK, it's not the same in Africa, and that kind of leaving them behind to catch up is creating a bit more suspicion as to what standard of the vaccine that they will get. So I think we ought to think about them and bring them into this conversation as early as now.
Grace, you've got something to come on there?
Yeah, I just want to make comment of that. Yeah, I think there's a say that he who has money controls. Unfortunately, this seems to be the case at the moment. I think in reality, I don't see the whole population being vaccinated by the end of this year. I wish it could, so that we can go back to some kind of normality. But I don't see the whole world being vaccinated, because like here we're talking about second dose to be after 3 months or 12 weeks. Like today, I just found out that the country where I come from, Malawi, the president has just signed about the vaccine. And I think the earliest we're looking about is April, if not later than that. So the poor countries, unfortunately, they're at the mercy of the people, the countries which should come money, because they're prioritizing their own countries, like the UK, the Europe, the America, Canada, they're prioritizing their own countries, unfortunately, and then later on others. So as I say, he who has money controls. So let's just pray that the inequality is not going to is not going to apply in this case. Let's all be at the same platform so that, you know, we can be back to the normality and everybody can be free, and we can be able to hug each other again and see each other, meet each other again for a cup of coffee.
Amen to that. I've got to say that. I'm going to go through a couple of quick fire questions. Charlotte, I'm going to come to you with this one from Esther. She says, can you have the vaccine if you're breastfeeding?
Yes, you can. There's no data on breast milk transmission, but this isn't felt to represent a risk, and it is recommended that you have the vaccine even if you're breastfeeding, and you definitely shouldn't stop breastfeeding in order to get the vaccine.
Thank you. I'm going to come to you, Lansford, on this one. How would you persuade someone who is very anti-vaccines to have one? Just a nice, easy one there for you.
Yeah, don't leave it too late. To be too late is dangerous. Don't leave it too late. We've been praying for the vaccine. We've been praying for help. We've been praying, asking God to help us. Help is here. And now you become anti-vax and say, no, don't take it. What else are you waiting for? There is no divine vaccine going on, vaccine development going on anywhere. This is what we have got. I will refer them to the gospel of the Bible in Acts of the Apostles, chapter 12 there. The church had a problem. Peter was in prison. They were praying for Peter. They were all in this house praying. And God miraculously rescued Peter. Peter came to the door and knocked the door. And this little girl, Rhoda, came out and said, oh, Peter is here. And went back and told him, they said, oh, you must be dreaming. You're out of your mind. She went and persisted. And they said, oh, it must be Peter's ghost. So they were praying for something. And God gave them the answer. But yet still they struggle to take it. And this is where anti-vax are. So please, God has blessed us with this. We have been praying. It's been fast. It's come up quick. Don't leave it too late, because delay might be too dangerous.
Thank you, Lansford. Thank you. I just want to see. I want to just throw it open. If one final one, just to come back, Biddy, again on this one. Is it safe for someone who is trying to get pregnant to have a vaccine?
I don't know about trying to get pregnant, but if you're pregnant, it's not currently recommended that you do have the vaccine. There will be some sort of niche parts of pregnant women, people who are also clinically extremely vulnerable. And for them, it will be an individual decision with their doctor. But for like Mrs. Average, who's pregnant at the moment, it's not recommended that you have the vaccine whilst you're known to be pregnant.
Thank you very much. Grace, I'll come to you, and then I'll come for some closing statements from all of us, and then I think we'll say good afternoon. So Grace, just to you, please, quickly.
Yeah, just like Charlotte. Yeah, the ones who are pregnant, they're not. I think it's up to the individual if they want to take a vaccine, but it's not recommended. As far as I'm aware as well. I cannot remember where I got the information from, but somewhere reliable information. They say if you're planning to get, then don't take the vaccine. But if you can delay it until after everything is all right, then you can continue trying for the baby. But it's not. If you are not able to delay, then don't take the vaccine.
We won't talk about how you can delay.
Good, yeah,
thank you, everyone. If you are following this broadcast on particularly on YouTube and Facebook, I know there are windows beneath our video with links to gov.uk for information from the government about the coronavirus. We do encourage you to go and read that information. It's, as Charlotte said before, it's peer reviewed. It's gone through lots and lots of critiques. It is not something that you would just find on the internet. It's from authentic sources. And most of all, can we encourage you to pray about it as well in your decisions, and pray for those in leadership, pray for those in our NHS as well who are on the front line of this. I want to particularly thank Charlotte, Grace and Lansford for joining us this afternoon, and for you guys for coming on for this broadcast. I'm sorry if we didn't get to answer all the questions. We did only say 30 minutes. We've now done 34 minutes. So it's really, really great. And thank you all for being there. And we hope to have another discussion, maybe about another topic another time. But can I just say thank you very much to all of you, and make sure we see you next Sunday for our service. Goodbye now.
Goodbye.
Bye.